So hi there, this is John Jay, and you are watching Health Talk with John Jay. To my followers and subscribers, thanks so much for your support. And if this is your very first time tuning into this channel, thank you and welcome. Today I will be talking about stroke and sharing some important facts that can save your life. So let's get started. Before moving forward, um, take a few minutes and read over my copyright and disclaimer. I own no copyright to any of the images or background music played in this video. So we're talking about stroke. A stroke is a medical emergency, meaning it is a very serious condition. And research shows that in the United States alone, in America, it is the fifth cause of death and leading cause of disability. And then most strokes event can be prevented. So getting treatment right away if you think you or someone is having a stroke is very important. By so doing, you can reduce brain damage and also reduce other complications that come with a stroke. So for this video, I will be discussing the cause of a stroke or what causes a stroke, the main types of stroke, symptoms of a stroke, treatment, prevention, and of course, I will be concluding this video. And my last slide will be my list of references. You may be wondering what causes a stroke. So a stroke happens when blood stops going to part of the brain, and because of that, the part of the brain that loses that blood supply stops working. And this happens because either the blood vessels that carries oxygen-rich blood to the brain is either blocked by a clot or that vessel bursts or ruptures like a balloon when you overfill that balloon and it pops or it ruptures. So it is the same that may potentially happen in the event of a stroke. So the vessel that carries the oxygen-rich blood to the brain is blocked out clot or that vessel bursts or ruptures. So when that happens, the blood stops going to that part of the brain and that part of the brain stops working. So the part of the body that the brain part controls will also stop working as well. So if that part of the brain controls your arm movement or your legs or your speech, that part will also stop working. So again, a stroke is a medical emergency. So moving on, we're going to be discussing the types of stroke. So there are two main types of stroke. Um, the first one on the slide is called ischemic stroke. And an ischemic stroke simply is when blood supply stops to the part of the brain. If you can look up, it's also an ischemic stroke. If you look on the bottom here of your page, just follow the red dots. An ischemic stroke is when blood supply stops to the part of the brain. And this blood supply is stopped by a clot that forms in the vessel. So looking on the picture below, just follow the red dot. This is what happens with an ischemic stroke. You see this clot is blocking the vessel, so nothing is going to go in or come out through this vessel. Now, the second type of stroke is called a hemorrhagic or a bleeding stroke. So, and this type of stroke happens when the vessel gets filled with blood, either because of narrowing of the vessel and that vessel bursts or ruptures. So if you look up the diagram above, let me draw my circle here. You see right here what happened? This vessel has this little pocket that looks like a balloon. So it has been narrow, and when the blood supply is going, it's collecting in this pocket. And over time, it's going to get so full that it's going to burst or rupture. And this is the second type of stroke. Now, other types of stroke are called a transient ischemic attack, or what is called a TIA, or most time you will hear the doctor say a mini stroke, like, this person had a mini stroke. So usually when people have a mini stroke, it's generally a warning sign that you will have a stroke in the near future. So a mini stroke or a TIA is an indication that you are at risk for having another major stroke event. But with treatment, this when you have a mini stroke, the symptoms usually goes away within minutes. But if you don't get treatment, the symptoms may take up to 24 hours to resolve. So let's look at symptoms or the classic signs, things that you will see that will let you know that either you or someone you know is having a stroke. So they may have trouble speaking or difficulty understanding other people. So like you will hear them, like maybe all of a sudden their speech will change or your speech will change. You will try to say cup and it will be difficult to say the word cup, or the speech will become slur, like another symptoms could be sudden numbness and weakness in your face, arm, and legs on one side of your body. Now, this will just happen out of the blue. These symptoms are symptoms that will just happen out of a blue. Like maybe you are home, you're watching TV, or you are working. All of a sudden, you notice that you can't speak, or you're struggling to say your words, or you having this sudden numbness and weakness on your face, arm, and legs on one side of your body. Another symptoms could be sudden change in your vision. So you may black out or like have a blackened area in your vision, or your sight in your vision is simply your sight, your eyesight. It may become blurry when you're looking at something that was clear. It may become a blur. Or you may have double vision, meaning you're looking at one object, but you're seeing two of that same object at the same time. So, and this can happen either in one eye or both of your eyes. Another symptoms is sudden severe headache. Like all of a sudden you hear, ouch! It's like you have this severe headache that you've never had before. And this headache is often accompanied with dizziness. So you, in addition to this headache, you may get dizzy with it, you may start vomiting, or you may go in and out of consciousness. Okay, and then lastly, you may also have trouble walking, or you will stand to take a step and you find out that you lost your balance or you lose your balance. Again, these are the classic signs and symptoms of a stroke. You may not have all of these symptoms at one time. You may have one and not the other. You may have two, or you may have all of them. But these are the basic symptoms of a stroke. So if you or a loved one, a friend, or family, or someone you know, and you are close to that person, or you are in that same area that that person is having any of these symptoms, you want to think fast. These are the classic signs of a stroke. So if you or someone is having any of the symptoms that I discussed in the previous slide, whether that symptoms comes and goes, or whether they have one and not the other, the important thing is to think fast. Because with stroke, the timing is critical. Every minute and second counts. Okay? The longer a stroke goes untreated, there is a greater chance for brain damage and disability. Okay, so and when I talk about disability, disability means you lose your ability to perform a certain function. For instance, you lose your ability to swallow, meaning you're not able to swallow anymore when you used to swallow before, or you lose movement in one of your arm when before you could move that arm, or you lose your ability to walk when before you were walking just fine. So the longer a stroke goes untreated, the greater the chance for brain damage and disability. So when I say think fast, FAST is an acronym that is used to address stroke symptoms, or to, just to confirm if in fact a person is having a stroke. So F in fast represent your face or the person's face. So the way to do that is you want to ask the person to smile, and when the person smile, you are looking for facial drooping. Facial drooping simply means if they smile, if one side of their face remains droop, like remains hanging downwards, while the other one is smile, the other side, is making a smile. And then A means arms. So you will ask the person to raise both arms and see if one arm drifts down or is weak. And then the S in fast represents speech. So you want to ask the person to say a simple phrase, and then you check in to see if their speech is strange or if it's slur or if it's garbled. Okay. And then lastly, T in fast represent time. So if you ever observe any of these symptoms, the important thing is to seek medical help immediately. So if you are in the developed countries, America, or any of those developed nations, you want to call 911 immediately. If you are in Africa or any of those outside country where 911 service is not available, you want to try to get yourself or the person to a hospital for medical help as soon as possible, immediately. So how is a stroke treated? So the treatment of a stroke, remember there are two main types of stroke. So for the ischemic stroke, which is the one that is caused when a clot blocks the vessel and prevents blood from going to the brain, the treatment for this type of stroke is to remove the clot by a medication called antiplase, or the short version is TPA. And what this medication does is that it dissolves the blood clot in the brain. So another treatment for an ischemic stroke is mechanical treatment by using a wire cage device, which is called a stent, to retrieve the stroke, the clot. So the mechanical treatment is a wire cage device that is called a stent retriever. All right. So if you look in the diagram above, you can kind of see up here, which is the wire cage device. Okay. Now, when we look at the hemorrhagic stroke, which is the bleeding stroke, emergency care is critical when you have a bleeding stroke. And this type of stroke, again, just as a refresher or reminder, is when the vessel bursts or ruptures. If you look above the diagram above there where it says hemorrhagic treatment, you can see this balloon that have formed along this vessel wall. So blood develops or builds up in this pocket, and over time this can burst or rupture. Okay, so this is a medical emergency. So the treatment for this type of stroke is focused on controlling the bleeding and reducing the pressure that is caused by the bleeding. Now, when we look at the TIA, or the transient ischemic attack, usually the treatment is by medication. Sometimes you may need surgery, and then another treatment is to adopt some lifestyle changes, which we're going to discuss further when we go into prevention of a stroke. Remember earlier I said that most stroke events can be prevented. So we are going to be talking about ways to prevent a stroke. Okay. So first and foremost is if you have high blood pressure. If you have been diagnosed with having hypertension or high blood pressure, you want to ensure that your blood pressure is under control. So monitor your blood pressure daily at least, and then take your blood pressure medication as the doctor prescribed. You want to limit your salt intake because salt can also raise your blood pressure because it makes you thirsty. And the more thirsty you become, the more fluid you will want to drink, and that causes your heart to work harder to pump your blood, and that will raise your blood pressure. So you want to focus on controlling your blood pressure and maintaining it at the normal level. Okay. Next, you want to try to control your cholesterol level. If you've been diagnosed with having high cholesterol, take your medication as the doctor prescribed and keep your cholesterol level in the range that you have been instructed by your doctor. If you have been diagnosed with diabetes, if you have diabetes, if you are a diabetic patient, you want to focus on controlling your blood sugar. And the way to do so is if you have been prescribed, if the doctor said for you to take insulin, or maybe you have been put on the pills to control your blood sugar, you want to take your insulin, take your blood sugar pills, you want to try to eat a healthy diet. Also, you want to try to incorporate some exercise in your daily routine. If you smoke, the key thing is to stop smoking. I know it's difficult because smoking is an addiction and it's hard to break off. But you can work on taking little steps at a time. If you smoke a pack of cigarette per day, maybe cut that back to half a pack a day. And then over time, you can gradually decrease the amount of cigarette that you smoke in a day. And eventually, you will be able to stop smoking. Another way to prevent a stroke is by adopting a healthy lifestyle. By so doing, you want to eat right. Try to stay away from high fat food. Most fried foods are unhealthy. So eating right, incorporating exercise in your daily routine. Try to lose weight if you are overweight or obese. And then lastly, you want to talk to your doctor about taking aspirin daily. If you have had a stroke, taking aspirin once a day can help decrease your risk for getting another stroke. But that's something that you do not want to start on your own. Any medication, make sure you seek your doctor's advice. Okay, we have come to the end of this video. So to conclude our topic, remember stroke is a medical emergency that can happen without any warning. And it can happen to anyone, even children as young as 9 years old. Okay? But 80% of strokes can be prevented. So knowing the symptoms and what to do can prevent brain damage and disability. So again, you want to remember to think fast. Thanks for watching my video. If you like what you heard, try to make the necessary changes and for yourself, for your loved ones, your family, and your friends. Please subscribe, like, and share this video with your family, friends, and loved ones. Be blessed and stay safe until next time. Bye.